Hi, my name's Hillary and this is Saria. She's very hungry, so we're going to show you how to breastfeed in a ring sling with a toddler. Okay, so first you're going to need to get your ring sling. I hear you. I hear you. So I prefer to wear my ring sling on my right shoulder so that way I can have her on my left arm. I know, babe. Miku Miku. Okay. Make sure the top rail's on the top and the bottom rail's on the bottom. So shift your baby over to the side that you prefer on. This ring sling seems to be adjusted for my partner, so I'll need to tighten it up. Ready for uppies? Muku muku. You'll need to get your baby, and then this is how I like to put my toddler into the ring sling. I'll shift her weight up onto my shoulder a bit. Come to me. I'm gonna put you uppies now. Okay? I know you want Miku, right? So I'll shift her up like this, reach my arm through the sling, grab her toes, and guide them in. Then I'll pull the upper rail up onto her back and then shift her butt down into a hip-seated position. I lean forward and then tuck the rail up between us. So you can see, again, I lean forward with my arm on her back and I tuck the rail up between the two of us. Now she has a very nice deep seat. If I need to shift the rings off to the side a bit, now she's too much in the front for me, you can reach into... So you're gonna, let me get this out of the way, reach up into the sling, like so. You're gonna reach down until you can touch her butt with your other hand. Hold the back of the sling and then jump and shift her butt over. So now you can see she's in a shifted position. Now from here, she's up a little bit high to have access to the breast, so you can loosen the rings a little, shimmer her down, and then you can just pop the boob in. And now you can see she is enjoying some Miku, as she likes to say, and it's pretty discreet in the ring sling, even without using the tail as a cover. I find that if I just take the top rail and kind of bring it up a little bit onto the back of the neck, it covers just enough of the mouth so that people don't really know what's going on without being too much out there. But if you feel like it, you can also use your tail as a cover for the top half or the whole thing, or on the top like this. That way there's not a whole lot going on. And then when I breastfeed in the ring sling, I like to keep my hand kind of in the area. That way if she does pop off, which toddlers are prone to do, like that, I can just easily shift either the tail down or my hand over to cover. Alright, so that's how we get toddler into a ring sling and nurse. Okay, so now I'm going to explain to you a cradle carry nursing variation for babies in a ring sling. This can be done with toddlers or infants. It's nice because sometimes baby likes to be in a reclined position better than a seated position, especially at a younger age. This isn't a carry that you really want to do for long term. It's really something you want to do just for the duration of nursing, and after that you can go ahead and move back into an upright position. So normally what I would start with is to loosen the sling, but I've already done that because she's just nursing. So what I'll do in order to transition her to the cradle carry position is I will lean forward with my hand supporting her back, and if she's younger, her neck as well. And I will grab her leg from the other side and bring it around so that both legs are now coming out of the same side of the sling. You're going to want to make sure to have a nice deep pocket around the back side of the butt. So you can see here that the bottom half of the sling comes all the way up. I know. Are you ready for Miku?
Yeah.
Alright, here we go. And then here you would just pop out the breast, and then you can offer to baby. Now she's deciding she doesn't want it. Would you like milk? Okay. So when she's ready to go back up, which she looks like she is now, I would again lean forward a little and then put my hands in between her two legs, jump, bringing her away from my chest, and then settling her leg back on the other side and tightening the sling back up. So there you go. You have two options. You can either do nursing in an upright position or in the cradle position. Thank you.